Good day and welcome to the webinar, Turning Schizophrenia's Unmet Needs into Commercial Opportunities. I want to thank everyone for taking the time to join us today. My name is Ines Guerra. I am a CNS and Rare Diseases Analyst at Datamonitor Healthcare, and I am your presenter today. Before we get started, I want to review a few housekeeping items and let you know how to participate in today's webinar. First, you should have a control panel on the right side of your screen. Towards the bottom of this control panel is a Q&A pane. You may submit questions or comments in writing during the presentation using the Q&A pane. All answers to your questions will be given after the webinar by email. Today's webinar is being recorded. The slides will be available upon request and additionally hosted on our service for subscribers. And now let's get started. So before I get into the actual presentation, I would just like to discuss with you what I'm going to cover in today's webinar. First of all, I'm going to start with a few slides, just giving you a brief disease overview. I'm going to discuss how schizophrenia patients are diagnosed. We're going to talk about prevalence numbers of schizophrenia, and then I'm going to discuss which are the key symptom domains in schizophrenia. Afterwards, I'm going to talk about how schizophrenia patients are currently managed. I'm going to talk about the current standard of care, what are the main advantages and disadvantages of the therapies that are used with schizophrenia patients. And I'm also going to give you a brief timeline of antipsychotic approvals. After this, I'm going to move on to a section discussing the current unmet needs and treatment challenges in schizophrenia. Now, while I'm going to discuss several current unmet needs, I am going to focus on non-compliance with antipsychotic treatment and how this can become an actual opportunity for drug developers. I am going to discuss briefly how long-acting injectable antipsychotics can actually become a tool to improve compliance. From then onwards, we're going to have a longer section on our key findings of our market forecast from 2015 to 2024. I will begin by giving you our forecasting methodology. Then we're going to move on to discuss the overall market size by country. Then I'm going to talk about what are the growth drivers of the schizophrenia market. And to do that, I'm going to split sales by formulation. So we're going to talk about sales of oral formulations versus sales of long-acting injectable antipsychotics. From then onwards, we're going to talk about the key long-acting injectable brands of the schizophrenia market. And then I'm going to focus on the future of the long-acting injectable segment as a whole. Before I leave you, I will have one final slide with the key takeaways and the conclusions of this webinar. So let's begin. Now, we know that schizophrenia is a chronic psychiatric disorder. Diagnosis of schizophrenia patients is based on criteria of the latest edition of the Diagnostic and Statistics Manual, and as of 2016, this is DSM-5. Now, in order for a schizophrenia patient to be diagnosed, he needs to present with 2 or more of the following symptoms. He can present with delusions, with hallucinations, disorganized speech, and these 3 are examples of positive symptoms. He can also present with grossly disorganized or catatonic behavior, and he can present with negative symptoms, by which we mean diminished emotional expression or lack of drive. Now, at least one of the symptoms that the patient display needs to be a positive symptom. So it needs to be one of the 3 first symptoms that I have just listed. Now, in terms of disease prevalence, our epidemiology team actually forecasted that the number of schizophrenia prevalent cases in 2015 was approximately 3.3 million cases. Now, more importantly, this is expected to expand to over 3.4 million cases in 2024, and this is across the US, across Japan, and the 5 major EU markets. Now, in terms of the main symptoms that schizophrenia patients display, they tend to be clustered into 3 main categories. We have positive symptoms, by which we mean psychotic symptoms, which tend to include delusions or hallucinations. Now, up to 1/3 of patients with psychotic symptoms tend to display a suboptimal response to therapy. This is the so-called patients with refractory positive symptoms. Now, in terms of negative symptoms, this usually means that patients with schizophrenia tend to display decreases in drive and decreases in volition. Now, these patients can display lack of motivation, a reduction in spontaneous speech, and even social withdrawal. Now, our epidemiology team actually estimates that over 1.6 million schizophrenia patients display negative symptoms as of 2015. Finally, we have the cognitive symptoms, and we know that schizophrenia patients tend to display difficulties with memory, difficulties with attention, and with executive functioning. Now, in the literature, it is estimated that approximately 80% of schizophrenia patients have some degree of cognitive impairment, and in 2015, this translated to approximately 2.6 million schizophrenia patients. Now that we've discussed how schizophrenia patients are diagnosed and how schizophrenia patients, which symptoms they actually display, let's just see how they are managed in current treatment practices. Now, we know that antipsychotic therapy is the backbone of treatment practices in schizophrenia, and this includes the use of typical antipsychotics and of atypical antipsychotics. Now, our most recent survey of psychiatrists actually revealed that oral formulations dominate the treatment practices in schizophrenia, particularly oral formulations of atypical antipsychotics. Now, before we move on to give you a bit more detail as to the two main categories of antipsychotics, I would like to briefly discuss a timeline of antipsychotic approvals. Now, I am going to focus on US approvals and not global approvals, because US tends to be the market that benefits from the earliest approvals of antipsychotics, and also it tends to be the market that has the most approvals of antipsychotics. In addition, our forecast actually revealed that the US market is by far the largest market for schizophrenia. So, okay, our timeline starts in the 1960s with the first long-acting injectable typical antipsychotics approved. Prior to that, we already had typical antipsychotics available, but only in oral formulations. Now, a few years after 1960, we had in 1989 the approval of the first atypical antipsychotic, and that's clozapine. Now, the approval of clozapine was important because it was a paradigm-shifting approval. Basically, as we're going to explore in later slides, atypical antipsychotics tend to display a much better safety and tolerability profile compared to typical antipsychotics. And the approval of clozapine meant that prescription trends changed. Physicians started to actually prescribe the atypicals instead of typicals due to their superior safety profile. Now, pharma companies realized this, and they saw there was an opportunity to develop new drugs. So after clozapine's approval, we had a series of other antipsychotic approvals. So between 1993 and 2015, we had a series of new atypical antipsychotics reaching the US market and even other global markets. The latest approvals were in 2015. We had in July the approval of Rexulti, and that's brexpiprazole, and then the approval of Vraylar, which contains cariprazine. The tendency was with each approval, the antipsychotics tended to present a superior safety and tolerability profile. Now, this slide already seems a bit crowded, and I'm only focusing on oral formulations for now. So the second slide will show you 6 additional antipsychotic approvals. We have approvals of long-acting injectable formulations of atypical antipsychotics. The first one was in 2003, and that was Risperdal Consta, but 5 other approvals followed. And now we can definitely see that the atypical antipsychotic class and just the antipsychotic class as a whole is very saturated. It has a large number of different molecules available, and this is an important point that I will go back to later on in this presentation. Now let's talk a bit more into detail about the 2 major classes of antipsychotics. As I mentioned before, we have firstly the typical antipsychotics. This class is characterized by displaying high levels of D2 dopamine receptor antagonism, and this tends to be the reason why they are associated with extrapyramidal symptoms, also known as EPS. Now, they are available in oral, inhalable, and injectable formulations. Injectable formulations can be either short-acting or long-acting injectables. Most of these short-acting formulations or oral formulations require daily administration. Now, in order to overcome some of the drawbacks of the typical antipsychotics, pharma companies developed the atypical antipsychotics, which are also known as second-generation antipsychotics. Now, these antipsychotics still display D2 dopamine receptor antagonism, but this tends to be coupled with also antagonism at serotonin receptors, namely serotonin receptor 2A. Now, these antipsychotics display a lower risk of EPS symptoms, but they are associated with metabolic side effects, and I'm going to talk about a bit more into detail about this in the next slide. Again, atypical antipsychotics can be available in either oral or injectable formulations, which once more can be short-acting or long-acting. And again, most of these short-acting or of the oral formulations are, they require daily administration. Now, I am highlighting here the atypical antipsychotics class because, as I mentioned before, our primary research survey from 2015 did reveal that atypical antipsychotics dominate the current treatment practices. Now, here we have a slide where we talk about the common side effects associated with atypical antipsychotics. Now, this is just a summary of some of the most commonly seen side effects, because atypical antipsychotics tend to display even more side effects than this. I decided to talk about the most common ones and just group them into three main categories. We have to the left the metabolic side effects, which can include weight gain, increased risk of diabetes, and hyperlipidemia. Below we have sedation or somnolence, and to the right we have again the EPS symptoms, which can include akathisia, which is restlessness, tardive dyskinesia, which is basically jerky involuntary movements, and Parkinsonism, where patients can display tremor or can display rigidity. Now, we can see that the older atypical antipsychotics like olanzapine and risperidone actually display symptoms of the three domains that I just mentioned. Although this is true for the older antipsychotics, we can see that actually most recently approved antipsychotics like lorazepam still display bothersome side effects. Lorazepam, for example, still displays EPS events and sedation. Even aripiprazole, which is known to be an antipsychotic with a very benign side effect profile, still displays events of akathisia, which is thought to be one of its main drawbacks. Now, my main goal with this slide is to just mention that although atypical antipsychotics do display a superior safety and tolerability profile, they are still associated with bothersome side effects, which can affect patients' compliance with therapy. Okay, so let's summarize the advantages of the current standard of care in schizophrenia. First, we know that the currently used therapies effectively manage positive symptoms in the majority of schizophrenia patients. This means that in the short term, they improve positive and negative syndrome scores, they tend to decrease hostility and help patients return to normal functioning, and in the long term, they help prevent relapse. But they are also associated with disadvantages. So we know that the currently used antipsychotics do not address negative or cognitive symptoms. They are still associated with bothersome side effects, and they still are associated with low compliance rates. Now, before we move on to our next section on the current unmet needs in therapy, I just wanted to leave you with this final slide. It is a bar chart taken from our primary research survey from 2015, and it shows us the top 5 drug molecules used in schizophrenia patients across the US, Japan, and 5 major EU markets in 2015. Now, what we can see here is there is no single drug molecule that dominates treatment practices. The patient share is spread almost evenly amongst a very high number of atypical antipsychotic molecules. And we can see that this is a trend consistent across the 7 surveyed markets. The top 5 molecules in the 7 markets are largely similar, only with minor differences in terms of relative positioning of the molecules. Not only this, it's important to remember that most of the molecules used nowadays are either off patent or they will be off patent in upcoming years, particularly by 2024, which is the end of our forecast period. So overall, this means that the antipsychotic class is saturated with undifferentiated drugs, so with drugs with largely comparable clinical profiles. And not only this, it's a highly genericized class. This means that we end up having a highly competitive schizophrenia market that can pose challenges to newly launched drugs. These drugs will struggle to penetrate treatment practices and to actually claim a significant share of the schizophrenia market. Now moving on to our section on the current unmet needs and treatment challenges in schizophrenia. Now here we have a chart taken once more from our primary research survey from 2015, where we asked psychiatrists if they could rank in order of importance a series of unmet needs that we had previously identified. Now we can see that improved efficacy for managing negative symptoms emerged as the most pressing unmet need for pharma companies to actually address. Now this is not surprising given the fact that negative symptoms are highly prevalent in schizophrenia patients. We mentioned that they tend to be present in almost 50% of patients. Also given the fact that there are currently no therapies that address negative symptoms, and also remembering that negative symptoms appear to cause a higher degree of functional impairment than positive symptoms do. Now afterwards, we have the need for treatments for patients with refractory positive symptoms that I mentioned before tend to affect roughly 1/3 of patients with psychotic symptoms. Now the treatment option for these patients tends to be clozapine, which I mentioned is a highly efficacious antipsychotic, but is associated with safety issues. Now the use of clozapine can induce severe events of neutropenia, and this is a life-threatening side effect where patients' white blood cell levels drop down to very, very low levels. Since clozapine tends to be the only therapy that proves effective in these patients, it's not surprising that psychiatrists want new alternatives. Then we see the need for improved tolerability of drug treatment, which again is not surprising if you recall the slide that I presented previously with the main side effects associated with atypical antipsychotics. These side effects not only affect patients' compliance with treatment, they can also affect the therapies that a patient can actually take. For example, an obese patient probably won't be a right candidate to take olanzapine, as the drug is known to be associated with weight gain. Then we come to the need for improved efficacy for managing cognitive symptoms. Again, not surprising to have this here, given the fact that almost 80% of schizophrenia patients display some degree of cognitive impairment, and there are currently no approved therapies that can manage these symptoms. And so finally, we reach the need for new treatments to address patient non-compliance. And I am highlighting this unmet need because this is where I'm going to focus on. This is the unmet need that arguably would be the easiest for pharma companies to actually address, and therefore is a key opportunity for them to explore in order to actually enter this highly competitive market. Now here we have a bar chart showing compliance rates with oral therapy in schizophrenia across the US, Japan, and 5 major EU markets by country in 2015. It is taken from our primary research survey from July 2015. Now what we can see is that actually compliance rates in schizophrenia are quite low. We can see that schizophrenia patients tend to miss approximately 40% of their prescribed dose of antipsychotics. And what does this mean? What are the consequences? Now, non-compliance is known to be linked to a higher risk of relapse, and we know that patients that suffer relapses are more likely to display violent behavior later on or to even attempt suicide. They are also known to respond worsely to treatment later on. Then we know that non-compliance with treatment can lead to hospitalizations. And just to give you an idea of the dimension of this problem, in 2005, the US cost of rehospitalizations due to non-adherence to antipsychotics was $1.5 billion. And then we come to just non-compliance being linked to overall poor disease outcomes. These three factors are some of the major causes of schizophrenia's high disease burden. Now, what are the causes of non-compliance with treatment? This is a very complex issue and several factors come into play. We can have patient factors, caregiver factors, even physician factors. I'm going to focus on illness and medication factors. Now, we know that schizophrenia patients tend to have poor insight as to the severity of their disease and their need to take therapy to manage their symptoms. Then we know that cognitive and negative symptoms complicate treatment further, because a patient that has cognitive impairment will likely not remember that he needs to take antipsychotic therapy. And then a patient with negative symptoms might lack the drive to collect his therapy and to actually take the therapy. Then we have medication side effects. As we've seen before, bothersome side effects are likely to affect whether a patient wants to take his medication consistently or not. And also complex regimens. So a regimen that involves combination therapy or that requires daily administration tends to be very burdensome and can actually be too demanding on a patient that often displays cognitive impairment or overall poor insight. Now, we've seen that non-compliance with antipsychotics is a major challenge in schizophrenia. However, it can be turned into a major commercial opportunity by pharma companies. We've seen that schizophrenia is a very challenging market, and if a pharma company can actually prove that they can address an unmet need, they could actually penetrate this very competitive market. And that's why we're going to talk about the long-acting injectable segment of antipsychotics. Now, long-acting injectable antipsychotics are injectable formulations of typical or atypical antipsychotics. They are intramuscular and tend to have lower dosing frequency compared to oral formulations. So they can be administered biweekly, monthly, or once every 3 months. Now, they are administered by a healthcare professional in an office setting. These 2 points can be turned into a tool to improve compliance. So we've seen that a daily regimen that involves daily dosing can be too demanding on a patient with cognitive impairment or just overall poor insight, and having a lower dosing frequency can help overcome this issue. Also, having the long-acting injectable antipsychotic being administered by a healthcare professional can at least eliminate cases of covert non-compliance. So a psychiatrist can know whether a patient is not responding because he's not taking the therapy or because he should be switched to a different antipsychotic. So as we've seen, long-acting injectables do show the potential to improve compliance and therefore improve disease outcomes, which would lower disease burden on patients, carers, and the healthcare systems. And it is important to think about the burden on the healthcare systems because they are going to progressively try and cut down costs given their tighter budgets. Now we're going to move on to our section on our key findings from our market forecast from 2015 to 2024. I'm going to start by explaining to you briefly our forecasting methodology. Now we start our forecast with the number of 12-month prevalent cases of schizophrenia by country, and this is given to us by our epidemiology team. If you want further detail, please refer to our schizophrenia epidemiology reports, where you will see prevalent cases from 2014 until 2034. Now, country-specific diagnosis rates and patient segmentation is given to us by our 2015 primary research survey of 236 psychiatrists. Now we have patients split into acute schizophrenia patients, so patients that are experiencing an acute psychotic episode, and stable schizophrenia patients, which are patients stabilized and that are taking antipsychotic therapy to prevent further relapses. Pharmacological treatment rates and split by first-line therapy or second-line therapy are given by the same primary research survey, and then brand penetration is derived from our primary research survey alongside drug-specific company-reported sales. We then add our market events, which can be approval of new drugs, can be label extensions or patent expiry dates. Compliance rates will be given to us by the same 2015 primary research study, and Datamonitor Healthcare assumes that compliance with long-acting injectables is higher than compliance with oral formulations. Then the cost per year of marketed therapies will be derived from formulary prices alongside our own dosing assumptions. For pipeline products, we benchmark them against currently available products. And this will take us to the the total annual sales per brand. Now let's start by looking at the overall market size split by country. We have here a bar chart taken from our forecast from 2015 to 2024, and then we have specific schizophrenia sales from US, Japan, and 5 major EU markets. Now we can see that in 2015, schizophrenia sales amounted to $6.3 billion, and these are expected to expand to over $7.8 billion in 2024 at a compound annual growth rate of 2.4%. But what are the growth drivers of the schizophrenia market? Now here is where we're going to start splitting sales by different formulations. We can see here a bar chart taken from the same forecast where we have sales pertaining to oral antipsychotics and schizophrenia sales pertaining to long-acting injectable antipsychotics. Now we can see that sales pertaining to oral drugs are practically flat, whereas sales pertaining to long-acting injectable antipsychotics are expected to expand at a compound annual growth rate of 5.6%. So they are going to expand from $2.4 billion to $3.9 billion by 2024. So by 2024, we expect the long-acting injectable segment to amount to 50% of the entire schizophrenia market value. Now let's talk about some key long-acting injectable brands, since we've already talked about the sales of the overall segment. Now I am going to focus on long-acting injectable brands of atypical antipsychotics, because as we've seen, this is the class that is dominating current treatment practices. They tend to display superior safety profile, and most of all, typical antipsychotics available in long-acting injectable formulations have been available for years and years, so they're all off patent, highly genericized, and therefore not very interesting in terms of commercial attractiveness. So let's start with the first two long-acting injectable franchises, which are marketed by Johnson & Johnson. So we have Invega Sustenna and Invega Trinza, which are long-acting injectable formulations of paliperidone, which is a metabolite of risperidone. Now, Invega Sustenna is a formulation that's administered once per month, whereas Invega Trinza is a 3-month formulation of paliperidone. Now, this franchise has an expected patent expiry date of May 2017 in the US, Germany, and Spain, and this is the first major key patent expiry that we expect. Now, risperidone Consta, on the other hand, was actually the first long-acting injectable formulation of an atypical antipsychotic to be available back in 2003. It's also marketed by Johnson & Johnson, and we're expecting the key patent expiries to start around 2020 in the US. Risperidone Consta is administered bi-weekly instead of being monthly or once every 3 months like Invega Sustenna. Now we have two long-acting injectable formulations of aripiprazole. We have Abilify Maintena and we have Aristada, recently approved in 2015. Abilify Maintena was the first one to be approved. It is marketed by Otsuka and Lundbeck, and it is administered once per month. We expect patent expiry to occur in October 2024 across all 7 surveyed markets. Aristada, on the other hand, is more specifically a long-acting injectable formulation of aripiprazole Loroxil. It is being marketed solely in US for now and is marketed by Alkermes. It can be administered either once every 4 weeks or once every 6 weeks. Then we have Zyprexa Relprev, which is a long-acting injectable formulation of olanzapine, marketed by Eli Lilly. The first patent expiry date we foresee is in September 2018. Okay, so now we've seen briefly what are the key long-acting injectable brands of the segment in schizophrenia. Let's talk about sales of these key brands. I'm going to start talking about sales of the Invega Sustenna and Invega Trinza franchise, which are the curve at the top in dark blue. So as we can see, actually the Invega franchise was the highest selling long-acting injectable franchise of the market in 2015. And to be precise, it was the highest selling brand in the entire schizophrenia market in this year. Now we can see that in the beginning, until 2017, the Invega Sustainer franchise will display strong growth, and that will be mostly due to patients switching from the oral formulation of Invega to Invega Sustainer, and also from patients switching from Risperdal Consta, the biweekly formulation of Risperdal, to Invega Sustainer, which is more convenient in terms of administration, given its once per month administration. Now in 2017, we have the peak sales of the franchise, which will be roughly $1.9 billion. In 2017, what happens, and the key event that will trigger a decline in sales, is the US patent expiry of the franchise. Now after that, we'll see sales declining over the entire, over the remaining period of the forecast. Initially, the decline in sales will be slightly dampened by the ongoing uptake of the 3-month formulation Invega Trinza, but sales will continue to decline until 2024 and will allow the Abilify Maintena franchise to actually overtake Invega Sustainer, Invega Trinza, and become the highest selling long-acting injectable brand by 2024. So let's talk about Abilify Maintena then. So Abilify Maintena was the first available long-acting injectable formulation of aripiprazole, and as we can see, it will display strong growth across the entire forecast period. This will be due to several reasons. So we know that Abilify Maintena benefits from a very large base population, because the oral formulation of aripiprazole is widely used by patients. It benefits from a very benign side effect profile, and also from very strong sales force and commercial resources of Otsuka and Lundbeck. So yes, we can see very strong growth over the entire forecast period, with peak sales expected to be approximately $1.3 billion. And after 2024, we cannot see it here because it's beyond our forecast period, but we do expect sales to begin declining due to the foreseen generic erosion of the franchise sales. Now we have in orange Risperdal Consta. So we can see that in 2015, Consta was actually the second highest selling long-acting injectable brand of the schizophrenia market. Despite this, we can easily see that Consta is a declining brand as sales are decreasing over the entire period of 2015 right up until 2024. Now this is firstly due to patients switching from the biweekly formulation of Consta to the once monthly formulation of Invega Sustainer. Then after 2020, we expect the decrease in sales to actually worsen due to foreseen generic competition that will follow key patent expiries. And then we have Aristada, which is the second formulation of aripiprazole available in a long-acting injectable formulation. So we can see that Aristada will also display constant growth across the entire forecast period, but this growth will be slightly slower in the beginning, so right up until 2017. So firstly, we'll have Aristada available in a once every 4 weeks or once every 6 weeks dosing regimen, and this is largely comparable to Abilify Maintena's dosing regimen. So Aristada will face strong competition in Abilify Maintena due to the high brand awareness of Abilify, and then also due to this very, very strong and substantial sales force and commercial resources of Otsuka and Lundbeck together. After 2017, however, we do expect uptake to pick up slightly, as Alkermes is planning to file in 2016 label expansion claim in the US. So we're expecting the FDA to approve this label expansion, allowing for a once every 2 months administration of Aristada, which will be a more favorable dosing regimen versus Abilify Maintena's monthly formulation. And we're expecting some patients to actually switch to Aristada. So we're seeing that sales will increase to roughly $700 million by 2024, but let's just remember that Aristada appears to be only developed to be used by US patients, whereas Abilify Maintena does benefit from a global launch, and sales will reflect that. And then finally, we have Zyprexa Relprev, which is, as I mentioned before, the long-acting injectable formulation of olanzapine. Now, we can see that Zyprexa Relprev's presence in the long-acting injectable segment is very small and will remain small across 2015 right up until 2024. Now, we believe this is due to the need to actually monitor patients post an injection with Zyprexa Relprev. And this is because the drug is associated with events of PDSS, known as post-delirium sedation syndrome, which is a life-threatening side effect. Now, the need to monitor patients does pose problems in clinical practice, and so psychiatrists are not very keen on prescribing Zyprexa Relprev in their current treatment practices. Then after 2018, we expect key patent expiries to occur, and generic erosion will lead to a further decrease in Zyprexa Relprev sales. Okay, so now we've seen which are the key brands of the long-acting injectable segment and how the segment is going to expand and go on to become roughly half of the entire schizophrenia market value by 2024. But the long-acting injectable segment as a whole shows potential for further expansion. And this is due to three main reasons. So we know that other atypical antipsychotics can still be developed as long-acting injectable formulations. Then we know that for existing long-acting injectable antipsychotics, new dosing regimens can still be developed. And two key examples are Aristada, that is going to be developed in a once every 2 months formulation, and also Invega Sustenna, which was developed later as Invega Trinza, formulation for once every 3 months administration. And then finally, we can have the use of long-acting injectables in additional psychiatric indications. So we can see here a bar chart taken from our primary research survey from 2015, and we asked psychiatrists if they could estimate how many of their prescriptions pertain to the treatment of schizophrenia, how many of their prescriptions pertain to the treatment of bipolar disorder, to the treatment of major depressive disorder, and to the treatment of other psychiatric disorders. Now we can see that the vast majority of prescriptions of long-acting injectable antipsychotics do pertain to the treatment of schizophrenia. However, we can still see that a substantial amount of prescriptions are targeting the treatment of other psychiatric disorders, particularly the treatment of bipolar disorder. So what this means is that while the majority of prescriptions is for schizophrenia, drug developers can use the use of the drugs in other indications to boost the overall brand sales. So they can develop long-acting injectables in additional psychiatric indications and promote use in these indications to just boost the overall brand sales. And now let's go on to the main takeaways of this webinar. So we've seen that non-compliance with antipsychotics is a key challenge in schizophrenia, like many other challenges that we've discussed. However, it can be turned into an opportunity, and it is arguably the easiest unmet needs in schizophrenia to be turned into a commercial opportunity and to allow newly launched drugs to penetrate treatment practices. Now, we've seen that long-acting injectables can help improve compliance due to a lower frequency of administration over oral formulations. And despite their current underuse, Datamonitor Healthcare expects prescription rates for long-acting injectable antipsychotics will increase due to their potential to improve treatment outcomes and just lower overall schizophrenia's burden on patients, carers, and particularly on healthcare systems. Now, we expect the long-acting injectable class to expand to over 50% of the entire schizophrenia market by 2024, contrasting the more stable oral antipsychotic class. And finally, the long-acting injectable segment as a whole has potential for additional growth as more atypical antipsychotics can be developed as long-acting injectable formulations. They can be developed with different superior dosing regimens, and they can still be used in additional psychiatric indications. Now, just before I leave you, I would like to just show you where you can find schizophrenia, our Datamonitor Healthcare schizophrenia content if you wish to do so. So here we have our website. At the top, you can see our disease tab over there. And if you click on it, you will be taken to second level of tabs where you can see the different therapeutic areas we are currently covering. Now, if you click in CNS, you will see the two main branches of diseases we're covering. So we have neurology indications and psychiatry indications, and you can click under psychiatry in schizophrenia. That will take you to our full disease coverage, where you can see our 2015 and 2024 schizophrenia forecast, where you can see the overall market size. You can see sales by country or drug-specific sales. This is accompanied by an Excel deliverable and an interactive forecast dashboard on your right. Then you can see our treatment content, which will show you the current prescribing trends for the treatment of schizophrenia patients, and that is again accompanied by an Excel data pack. You have our epidemiology team's report on the prevalent number of cases of schizophrenia that covers a period from 2014 up until 2034, and it does have additional patient segmentations like segmentation by age and sex, or segmentation by the predominant disease symptoms. And then finally, you have our in-depth profiles of marketed drugs used to manage schizophrenia patients, and also pipeline drugs being developed to treat schizophrenia patients in the future. And that is all from me. Thank you very much for joining us today. And please, if you do have any further questions or comments, email them to pharma@informa.com and we'll get back to you. Thank you so much.